started. And hello, everyone. Welcome to Choosing the Right Supplements for Menopause. I'm Laura with Elektra Health, and thank you so much for joining us today and taking time out of your busy schedule. We know everyone's really busy, and so we really do appreciate you being here with us. And we are thrilled to be talking about supplements today because we get asked about supplements here at Elektra all the time. Over 50% of women in midlife use supplements. So there's a lot of people using a lot of supplements, and we want to make sure that everyone is safe when they're doing so. The good news is that there are a ton of supplements out there that have some good data behind them for their efficacy and their safety. On the flip side, there are a lot of supplements out there that make a lot of claims about their effectiveness in treating certain symptoms, especially for menopause, where women are often kind of really just want to try to get some relief. And there are some supplements out there that just don't have a ton of evidence behind them. So what we want to do today is give you some information so you can make the best consumer choice for yourself and learn how to choose supplements that are effective or have the potential to be effective and that are safe for you. We will be kind of running the gamut of supplement topics. We'll be talking about our top 10 supplements specifically for menopause symptoms. We'll be talking about how to choose a brand, what to look for, what to stay away from, how to use supplements so you know that they are actually working. And we're going to talk a little bit about CBD, which is kind of like this hot topic and is being used more and more by women, and really being used more by everyone. And then we'll have some time at the end for Q&A. So, if anything sparks a question throughout this conversation, then we will hopefully we'll get to answer all of your questions, but we'll answer as many as we can at the end. So many of you are familiar with Elektra Health. And for our members, we want to give you a special welcome. But for those of you who aren't familiar, Elektra is a digital health company helping people navigate the menopause transition and beyond through education, community, and care. We have a membership platform where with a ton of MD vetted education and resources. You can work with your very own Elektra guide, which is an RN or a doula with specialized menopause training who can give you one-to-one support and one-to-one recommendations, and you have access to clinical care. So I'm excited to introduce our two experts, although one is still seems to be on her way. She might not be able to make it, unfortunately, but thankfully, Elektra's founding physician, Dr. Anna Barbieri, menopause expert and integrative medicine specialist, is here. And I'm going to let you give your own little introduction. And if Dr. Shepard gets on, you can punt it over to her. So take it away, Anna.
Awesome. Thanks, Laura. Hi, everyone. Welcome to our presentation today. This is such a hot topic, and it's a good and important topic because we know just how many of us are using supplements, how many women are confused about supplements, how many women either do not bring up their supplement questions with their healthcare provider, how many women are afraid to bring it up because they're afraid already of kind of the preconceptions that are out there about supplements. So I'm excited to talk about it. My name is Anna Barbieri. I am the founding physician of Elektra Health. I am also a physician in practice. I am a practicing OBGYN physician, although I don't deliver babies anymore. I focus on the care of women in midlife, especially during the perimenopause to menopause transition. I'm also a certified menopause practitioner, and I also teach medical students and residents on the topic of menopause. So I'm excited to be here.
Hello. Hi. Can you hear me?
Laura, you're muted.
Sorry. Hi. Did Dr. Shepard make it on?
Yeah, I'm on. Can you hear me?
Good.
Yeah.
So just, Dr. Shepard, why don't you give a brief intro of yourself?
Yeah, absolutely. I'm Dr. Jessica Shepard, gynecologist and also minimally invasive surgeon. But I really have transformed my practice, over the last 5 years into menopausal health and also targeting perimenopause and sexual health. And currently, I'm also the Chief Medical Officer at Very Well Health, where we are the largest online publisher for health. And last year, the co-founder of Stella Via, which is an entire line devoted to menopausal health and really helping patients throughout that transition. But so excited to be here with Elektra Health and going through all of these different supplements and how we can find different ways to use alternative methods for our health metabolically, but also with symptoms.
Great, thank you, and welcome, Dr. Shepard. So super excited to have you with us today. A quick review of the agenda. Like I mentioned, we're going to leave time for Q&A at the end. So if you have any questions throughout the course of the presentation and the conversation, feel free to leave them in the chat. If you'd rather they be anonymous, you can send them directly to me, Laura at Elektra Health. And we're going to try to answer as many as we can in the last 15 minutes or so of the presentation. A couple of disclaimers. Elektra is not sponsored by any of the brands that we might mention here. So you're getting a very kind of objective, very objective recommendations. This event today is for educational purposes only. This does not qualify as medical advice. We're really here to empower you to make the best decisions for your own health and help you understand the questions to ask your healthcare provider when considering any of these supplement options. And without further ado, I'm going to hand it over to Dr. Barbieri.
Thank you, Laura. So to start us off, I wanted to kind of go over the definition of what supplements are, how they may fit into your healthcare routine, how they fit into certainly my healthcare routine, and as well as my medical practice of my patients, and kind of guide you a little bit through thinking about the use of supplements. So as Laura said before, supplement use is very, very high. Some of the studies, as many as over 50% of women in this age group, so midlife and beyond, use supplements. What are they? Well, supplements are basically fall into different categories. They can be vitamins, such as vitamin D, for example. They can be minerals, such as calcium, or they can be botanicals or enzymes. And botanicals will have, for example, herbs in them. Many of you, I'm sure, have heard of black cohosh or red clover or something called Vitex. And these are just examples of botanicals. You can also find certain enzymes and amino acids in a sort of a separate bucket. Supplements are commonly used, but you will find out there, and especially in the current sort of medical, and especially in the current medical online world, sort of two different extreme stances on this topic. Either you'll find that some people really, really prefer to use supplements and look at them as a preferential tool compared to, let's say, hormone therapy or medications. We'll call them pharmacologics. And then there will be a lot of people on the other extreme that really look down on supplements and claim that supplements are unsafe. Nobody should be using them. We should only be focused on FDA-approved solutions. And certainly in my personal life, as well as in my practice, I look at supplements as just one of the tools we have, and we can consider them for various reasons. We need to treat them like we would treat anything that we ingest for the purpose of improving our health, prolonging our health, or fixing a health problem, and also be conscious of some of the very similar concerns that we have with medications. So again, I look at supplements as tools. They can be useful in certain circumstances, but we need to be cognizant of the potential pitfalls with them as well. We should know that supplements are not regulated by the FDA, which means that manufacturers of supplements do not need to go through the same rigorous trials for both safety and efficacy that FDA-approved medications are subject to. And this can be problematic because there are manufacturers that may be driven by marketing concerns and financial concerns rather than efficacy and safety of their product. But that does not mean that there isn't data on safety and efficacy of at least some supplements. So I do think it's important to keep that in mind when we choose this tool, as far as choosing a product that has evidence behind it and quality evidence behind it, as far as its safety and efficacy goes, despite the fact that that product has not been subjected to the same scrutiny that a medication may be subjected to. The first kind of thing I think about when I help my patients and guide them through sort of a supplement decision, and I actually kind of use this framework even for medications or hormone therapy, like for everything, is really number one, trying to figure out how someone is doing and what the reason is for this tool. And again, that applies to supplements, medications, hormone therapy, but here we'll focus on supplements. What are someone's symptoms and what are the potential reasons we're using that supplement for? Is it for prevention? Is it to correct a deficiency? For example, like with vitamin D, when if we get a certain vitamin D level, we can actually figure out a recommended dose to correct that deficiency? Or is it for treatment of a specific symptom? Let's say in menopause, that may be hot flashes or that may be insomnia. What are we talking about? Prevention, something we take general, correction of something, or symptom relief? What are the options we have in this group? So, vitamin D deficiency, that's pretty easy because we're going to use vitamin D, although there are different forms, we can combine it with different things. But when it comes to something, for example, like insomnia, there's a whole list of different supplements. Many of them have data and evidence behind them. Some of them may help both with hot flashes or night sweats and insomnia. Some of them may be insomnia specific. How do we sift through this? So you kind of have to keep in mind what the options are. What are the higher quality options here? How do we evaluate the quality of a certain supplement? So Dr. Shepard and I will go through that and give you some tips about that you can literally use today when you look at the bottles you may have in your kitchen or medicine cabinet, or when you go to the pharmacy and try to pick something up, or even when you look online. We have to, once we've identified a potential product or type that may be helpful in your situation, how does it fit into other medications or supplements that you may be taking? How do we know that it will not interact with them? What are the potential side effects and cross reactions? And what are we looking for? Is there evidence for harms and side effects that we need to be aware of? And how are we going to monitor your response? And how are we going to decide and when to maybe change course and stop something, add something, or alter the regimen? And I would say here, every day in my practice, I do see patients who bring me sometimes a whole bag of supplements. I often think, and this is what I tell them, is that these are tools, and sometimes we need to examine our bag of tools. And if there is one medication that may replace 20 supplements, that may be a better option. Certainly for people that are using multiple supplements, sometimes I also see very sort of extensive use of supplements without any sort of advice or oversight. And there's just so many of them out there that it's difficult to sift through all the side effects and pluses and minuses. So I do think it's very helpful if you are a supplement user to disclose that information to your provider. Bring the list of them with you. And if that list is extensive, try to kind of whittle it down. I think often we can do that, and that will kind of save bottles, plastic, time, and money as far as your health management. Next slide. Yeah.
So what we're seeing here is looking at the top supplements. Is that what slide we're putting up perfect. So just like Dr. Barbieri said, I think that one of the things that I've seen in my practice as well is people feel that they need to be on one side or the other when it comes to whether medications or hormone replacement therapy or supplements. So I think it's very important for people to understand that there is quite a balance that can occur. And I think that there's always room for each and every one of these supplements, as you're seeing here on this slide, and how to really focus, I guess, how that works best for you as an individual, because you're going to find that what works for someone will not work for another. And so that's where the relationship and the discussion should be so impactful and so important when you're thinking about what's going to be useful for me and how can I make that work into my everyday life, because you do want sustainability and you really do want some kind of ability to have something that you're going to use long term and works for you instead of shifting all the time between certain things. And so when we look at supplements for menopause, I think that there are key factors based on your symptom. And then there's also tolerability and safety that comes with that as well. And then really figuring out what are the things that are priority for me as an individual before deciding, just like Dr. Barbieri said, some people come in with a full bag of supplements. And I always ask my patients, well, which are your top symptoms? And is this sustainable for you at the level and the amount that you're taking before you're going to continue to take all of these? So as we look through some of the supplements here, which we'll cover a little bit more in detail as we're looking at the actual symptomatology and what supplement is going to carry you through that. One of the top ones that I've known, ever since my training, and a lot of patients would come in and ask me about these specific ones, is definitely black cohosh when we're looking at hot flashes and night sweats. And then really figuring out what are actually behind these, what is the sustainability and the safety. But black cohosh is an herb, and it really has a common ingredient that's used to treat symptom of hot flashes, and it's also a phytoestrogen. So when we look at really the benefit, you want to be able to say, I want to be able to see what the benefit is for me individually. And if it's not, then that it's okay. And I think it's okay for people to understand that they can actually move on from something and try something else. So as you can see in each of these boxes here, we have listed a variety of supplements that can go with an actual symptom. The goal here is when you're looking at these is not to say that I have to take all of these in order to offset the symptom that's listed on the left, but which one of these am I willing to consider in a conversation and trying and seeing if it's working for me. So now as we work our way down to sleep, obviously, many people know that melatonin is helpful for sleep, and there is really good study and data behind melatonin, as well as magnesium glycinate and ashwagandha. But again, knowing the differences between those. And if you are on medications, reviewing that medication list very extensively with your provider to decide, is this the one that I'm going to take? Is it safe for me? And again, is there going to be interaction with the current medications that I'm taking? And then with bone health, obviously we see a supplement with calcium. The important part here is to remember that with calcium, there was a lot of data earlier on, maybe about 15 years ago, that really wanted people to significantly increase their calcium, and people were doing that, but at not a very safe amount. And then we had some issues later on when we were looking at kidney. So again, making sure that you're staying up on the literature and talking to your provider about how I'm going to take the supplement and what is the right amount. And then looking at PMS and mood changes, this is actually something that you start to see very early on in the perimenopausal phase. So looking at all these different supplements that are going to help with your mood changes. And then immune function, we know that that's actually going to decrease significantly, not only with the menopausal transition, but with aging. So it's important to remember that there's a lot of things that occur because of estrogen deficiency and decline, but a lot of things that may occur because of just simply aging. So immune function is one of those as well, in addition to joint and muscle pain, which you'll see here, magnesium is a part of that joint and muscle pain. And how is that, again, going to impact me? Because there are magnesium deficiencies in menopause, and most will experience low nutrient levels during the menopausal transition. So magnesium deficiency is actually very common. And so knowing what those effects are going to be on your health, and then finding the best way for those to be supplemented throughout your life. Next slide. All right. So I actually really love this slide because this slide is really, I think one of the most common questions that I get in my practice is, am I in menopause, and what is perimenopause, and which one of those am I in? And so just looking at this, you'll see definitely from this diagram, there's a lot of overlap between the two phases. And we know from a clinical standpoint, menopause is when you've had 12 months consecutively without a menstrual bleed. And so that it basically is letting us know that the follicular level, or the follicular ability to elicit enough estrogen to have a bleed, is when you have reached menopause. So before that, which can last anywhere from 7 to 10 years, is going to be your perimenopausal phase. So these are, again, just a very quick overview of which supplements might work for you during a certain transition of where you are between perimenopause and menopause. And obviously you're going to have overlap, and it doesn't necessarily mean from this diagram that you can't take something that's in the perimenopausal circle as you transition into menopause, but this is a beautiful diagram to kind of showcase that. Next slide. All right. So we're going to split this up between the both of us, looking at these points on what to actually look for in a bottle. And I'm going to let Dr. Barbieri do the first three.
All right. Thank you, Dr. Shepherd. And just to second what you said about that previous slide, I think it's very, very important, not even for supplement choices, but even for hormone therapy choices or medication choices, to really know if we're talking about perimenopause versus menopause, especially that early part of perimenopause. In a hormonal way, it's very different from someone who is 6 months from their last menstrual period or 2 years from that period. So that's why we see, especially with supplements, kind of a different profile of supplements for early perimenopause versus menopause. And that's going to stem from symptoms that are elicited by different hormonal profiles in those phases. So how do we really know that you're getting a better quality supplement, and what do you look for? And you can do this literally for any supplement out there, and I would encourage you to go through this exercise at home. So number one, any supplement you ingest should have a very, very clearly defined ingredient list. There should be a list of items within it, including amounts. Those are going to be usually listed in milligrams, as well as something called RDA. RDA, which is sort of the recommended daily amount, unfortunately is not defined for a lot of ingredients and supplements. So it's fine to not have that info. But if you're really looking at a supplement and it does not have ingredients listed and the amounts of them, and just says, proprietary blend, and doesn't list anything, that's a major red flag. And I would even say sometimes when you see proprietary blends of multiple different herbals that just come up with 1 milligram amount, to me, that's also a red flag. I really prefer to, if I'm going to use supplements for someone, to opt for the ones that have, where we clearly know what is supposed to be in that particular bottle. You also have to keep in mind the reason for using it, and look for a general statement of use. And here a red flag would be a claim that a supplement can cure something. Actually, legally, supplement makers cannot claim that. They cannot claim that a product is meant to treat or cure a disease. If you see that, that's also a red flag, but a general statement of purpose should be there. May help with hot flashes, for example, would be that. Obviously, expiration dates are important, and you do want to buy something that's really way ahead of its expiration date. And I think Amazon these days has gotten better about their sort of delivery chains and storage. But I don't know if you've ever, any of you bought perfume on Amazon. It may not smell the same as you buy perfume from a let's say a store that you go to. Same with supplements. You want to buy supplements from a purveyor or manufacturer or store that is equipped to store and manage inventory in the right way.
So when we look again now at the last 3 points, which I'm going to discuss the specific instructions on the administration. So this goes more to users and sometimes feeling like you may need more than what's actually recommended. So making sure that when you look, just like you would with any medication, is when you look at those actual instructions that you stick to that, and make sure that you're not taking more than what is elicited on the bottle or the package itself. And then also the manufacturer name and address. There are a lot of supplements that actually are white labeled and maybe not made in the best process. So you want to look at the manufacturer name and address and making sure that they're coming from reputable labs or labs that actually are specifically doing supplement and vitamin and mineral manufacture, because that is a big part of why you might hear that you might have some camps that really don't facilitate or want people to use supplements, is because maybe there is concern about where it is made and how it was made. So making sure that you actually pay attention to that. Now, when we're actually looking at what is that integral part of how it was made, when we're looking at dietary supplements, is making sure that it's from a trusted source. So the manufacturers should be very responsible for evaluating the safety and labeling of their products to ensure that they do meet federal regulations before they go to marketing. And when we look at that, problems may be encountered with the actual manufacturing of these products, you want to know, is this product made to the highest quality standards? I'm sure there are many patients who say, well, you're recommending this supplement or this vitamin, but which one do I take? It can be very overwhelming when you go to a pharmacy or you go to a supplement store and you see the same actual supplement, but there may be a variety of up to 10. So which one is the one that you can choose? So it's just similar to the same thing that we say when you go and read your labels for food and nutritional labels, is to have that background and understanding what that third party certification is and what did they actually do to verify, what are the programs that they use, which are, again, you'll see here listed with the UL certification, the GMP, the NSF, and the USP. Those, again, are things that you want to look for on the label to ensure that there has been an actual independent source that has actually done the certification of that product and also conducted a product review. Next slide. All right, so this, again, we did a hallmark with the beginning of this program that nothing here is sponsored for this program. We just want you to be aware of some of the products that we love and going through those so that everyone can feel that they had some insight into actual products that are recommended. But again, these are not sponsored. So these are a list of those brands that you love specifically. So I think that Metagenics, from my perspective, I really love what they bring to the table and the science that they take behind their products. And also some of these other ones also listed, plus CBD now is a good one. Dr. Barbieri, which ones would you say of the ones that we went through and listed that we love that you have maybe a hint up on some of these that you prefer?
Sorry, sure. So these are brands that I use in practice as well. That I would say I used now Pure Encapsulations, Metagenics, Integrative Therapy. I use all of them, and sometimes I will have favorites within those brands. I also want to give a plug to Kirkland, which is the Costco brand. Costco actually spends a lot of money on their quality assurance and their supplement production. So if you're looking for something that's maybe is a little bit more basic or you're going to use for a long time, I think actually Costco brands are pretty it's a good choice for the value that you get, especially.
That's interesting that you bring that up. I had a quick question when we're thinking of those specific brands. What would you say? Now, I'm a fan of things that are smaller batch. Now, if they are larger batched, how do you kind of guide someone through that typical volume size in the supplements?
It really depends on what it is and whether something needs a certain type of storage. So for example, fish oil, Fish oil capsules, ideally, especially if you get a bigger batch, should be in a dark bottle or a bottle that does not permit light to go through it, because fish oil can spoil. So like something like that, you either want to make sure that you're going to be, if you get a batch, you want to make sure that you're going to be using it within a month, or have a storage vehicle or storage environment that will preserve the quality of that supplement.
Next slide. All right, so this is, again, something that's very high in the development of, and something that's obviously becoming much more popular, not only in just in menopausal women, but obviously scale. So this is now looking at cannabinoids and what they have taken over in the industry, which is for good reason. I think that there is so much more that we can learn from this industry and how it's helping with people, not only in menopause symptoms, but chronic pain and inflammation and migraines. And a lot of these, if you were to look at that map that we had, the Venn diagram of perimenopause into menopause, is a lot of the pain issues that you'll see that that happen during perimenopause and menopause are actually things that we have been using medicinal CBD for years now. So the chronic pain and inflammation and migraines and autoimmune diseases that you see that actually occur more in women, and also depression and anxiety, make this a really good treatment for postmenopausal women because of some of these symptoms that come because of estrogen deficiency. So, there are studies that are being done specifically in the pharmacology world that really are reporting now with the estrogen deficiency, what we are seeing from CBD and how they're showing marked improvement in some of the areas that I just mentioned. And so we are starting to see more data, when before it was a lot of just observational case studies that were done with the cannabinoids in adults, specifically 50 and over, because we want to make sure from a perspective of safety and efficacy, specifically when people are aging, that we know that the response is going to be different, that now we're seeing that put towards women's health. And I'm sure for some of you who have seen yesterday that the White House just announced that they're doing an initiative to women's health, it would be wonderful if we can start to see some of the CBD and supplements that we're mentioning throughout this session, that those are also being a big part of women's health initiatives as well, and the research that's really should be done towards what we're seeing in menopause. Next slide.
So I'll speak a little bit to this. I think currently, when it comes to CBD products for women's health specifically and menopause, I do think that here we're at the moment where marketing of these products actually exceeds the data we have on their efficacy and safety, although like Dr. Shepherd said, there is more and more information coming out. The use of CBD and THC for menopause is nothing new. I actually did research about the historical sort of trends in menopause self-treatment. And as early as the 19th century, you can actually read stories of women using cannabis for menopause symptoms. And the other big sort of self-treatment back then, which is not different today, was alcohol. And we can do a whole other story on that. But yes, so alcohol and cannabis have been with us for a long, long time. We are seeing more data, but currently, the use of CBD, I'll leave THC aside here. We're really we have a lot of data on the use of CBD for things like epilepsy and anxiety, and some more data coming out on sleep. Unfortunately, when you look at the products that are available over the counter, many of them actually do not have the amount, I'm speaking about CBD here specifically, that is being used in studies. And I think it is for that reason that we often hear, I used CBD, but it didn't help me much. It doesn't mean that you can't try it, but I think we have to have a healthy dose of skepticism when it comes to using these products. Just like with other supplements, I always recommend that we try to find a brand that is clear and transparent about their practices, including sourcing of ingredients, provision of certificates of analysis, preferably third-party lab testing on their quality and ingredients. And any CBD product that's claimed to be CBD should actually contain very minimal to no THC. And THC is part of the cannabis plant that is the psychoactive part, where CBD is not. By definition, CBD should be less than 0.3%. And here is where we run into a problem. Like, there was actually a study a couple of years ago that looked at the available CBD products on the market. And many of them, I think the number was close to 10%, included THC in levels exceeding 0.3%. And once you add THC, for example, to a CBD sleep product, no wonder, like, that product is going to be more effective for sleep. So, so really here, kind of, to summarize this, I think, I'm pretty excited about the development of this field, but I think it is early, and I think we need to be really aware of the data that's out there, the data that is not out there, and the marketing behind these products as well. And I think we're all aware of the marketing. I think, I own a dog, and I feel like I could buy my dog, doggy lotion with CBD these days. So that purports to make him live forever, which I would love. But
yeah, no, I totally agree. I
yeah.
think because it's so new on the market as far as being sensational, I think that everyone kind of wants a part of that. But I just wanted to add the part of, the hesitancy around CBD and THC, is that this is what we do know from literature, is that the endocannabinoid system is really a collection of cell receptors, and they're all over the body. And so before, I think we had just a lot of connection to it in the brain. But now that we're realizing that it really has such an impact on so many organs and tissues, that's why we're seeing that CBD really can have an influence on how it impacts menopausal symptoms, when we think of mood regulation, obviously, but also with pain and sleep and memory. And so we know that during the menopausal phase, there seems to be this disruption of the endocannabinoid system. And so the ability for us to show in studies how that can rectify that communication and correlation between the receptors, and then how it gives us the experience that we have during menopause with these multiple symptoms. Like you said before, Dr. Barbieri, I'm excited to see all of the changes that are going to come with the strategies and treatments that are ahead, but also keeping in hand that we do have safety and risk factors to look at when we think of possible negative effects or how the body actually metabolizes. And ultimately, at the end of the day, we want to make sure that people are safe and that they're getting the best outcome when they're using some of these supplements and products. Next slide. We're at the Q&A slide.
We're at the Q&A slide.
Yes.
Wonderful. So we do have some questions. I'm kind of going back to the beginning here. How long is it safe to take certain supplements?
Yeah, I think I'll answer first, and then I'll let Dr. Barbieri, because she really is like the guru behind all of this. For me, particularly in my practice, I think the main important part is what you take as supplements. We don't want you to take 20 supplements at one time. I think the goal is, as you're going through every part of your life in transition, your supplements may change over time. And the other part is not to take supplements in lieu of a medication that may be giving you your best health outcome. So there needs to be a lot weighed. The goal, I would say, the three things that I would say, how long it is to take certain supplements, that there are some that are just good for long-term use, whether that's maybe something like vitamin D. But then there are some supplements that may just have to do with a certain symptom and or issue, and you may need to take it just during that time. But the ultimate goal is to find what for me as an individual is going to be the amount that I can take sustainably for a certain amount of time. And there are some supplements that are very healthy and fine to take for a long-term course, whether that's for the next 10, 15, 20 years. But that needs to be a discussion where you're coming up with a strategy and a plan and understanding why you are taking a certain supplement and not just to take it because you think it's something good to take, and really having some strategy behind that. Anything else you wanted to add, Dr. Barbieri?
No, I would agree with that. So I think there are certain points in one's supplement experience that are very important. The first one being, do I need a supplement and why do I need it? Number two is, when do we check if it is working, if it's something that can be even defined? So for example, we mentioned fish oil. You're not going to really, unless you're measuring levels of certain omega-3s in your blood, which most people don't, you may not be able to see the outcome of that. Three, how do we evaluate for side effects? So I think it's, I really agree with you. I think here it really depends on the supplement and the purpose for which it is being used.
Right. Thank you. This is a good question. Great question. What are your thoughts on the Menopause Society's recent non-hormonal statement as related to the use of supplements for vasomotor symptoms? So for hot flashes.
Yeah, I think this is a great question. So in this year, actually, I think it's 2023, the Menopause Society, previously used to be known as NAMS, now it's the Menopause Society, came up with a statement on the use of non-hormonal therapies for menopause symptoms. And before we even get into the statement, I do want to say, as a 50-year-old woman and as a physician in this space, we cannot out diet or out supplement ourselves out of hormonal loss. So yes, I do use a ton of hormone therapy in practice, and I think it is the most effective way of treating menopause symptoms. Having said that, not everyone wants to use hormone therapy, and not everyone is a good candidate for it. So we do have some other non-hormonal options. They include things like non-hormonal medications, certain practices like cognitive behavioral therapy, hypnosis, for example, and supplements. So anyway, the Menopause Society came up with a statement that they are in support of the use of certain medications, such as SSRIs, which are antidepressants, or gabapentin. There's a new kid on the block called fezolinetant for hot flashes. They are in support of hypnosis and cognitive behavioral therapy, but they are not in support of supplements. So we do need to know that, and that's out there. The reason why, so now we have to examine the reason why they said that. And the reason why is because the Menopause Society uses a certain benchmark for medical evidence. And the way that medical evidence is generated on efficacy of a product is by running very large trials. And it's a great setup. We do need to test things to see if they work. And because most supplements have not been subject to the right duration or magnitude of the trial, that was not included in this recommendation. And because the safety and efficacy of these products are not established using the same criteria. That is why, even though in practice, supplements are not going away. I'm sure Dr. Shepard and I meet patients every day who do not want to use hormones or cannot use hormones and rely on these. I don't think, this is my personal sort of opinion here, I think we do need to know about supplements because our patients are using them. Some of them may be helpful. Many of them have data about harms and effects and efficacy, and we need to be able to help our patients wade through them. So I, as a physician, I would much rather know how to advise patients about supplements, be honest about whether a supplement is useful or not, know about it, rather than to paint everything with just a black and white broad brush, because I don't think that's how the world works. And that will also limit how we can help people.
Yeah, I think
What do you
everything
think?
that
Yeah.
you said,
Yeah.
is spot on, and that's, how I fashion my practice as well. Because what we have seen in the very far past in history is that people, before we even had medications, found ways for supplements and vitamins and herbs to really impact how they felt. So what we do now have is, a regulation through FDA that does studies for good reason. But I do think that we are coming to a time in how we treat as physicians and healthcare providers is allowing people to have the backing behind using supplements and giving them also the agency and the freedom to use something that is not a medication that can have benefit for them. How I guide my patients when they want to try a supplement is, well, one, why do you want to take it? What is the symptom that you're having, and could this be helpful for that? But also allowing them to feel as if they have some agency in what they would like to take, with giving them good parameters, safety measures, if there is data on it, which a lot of these do have data. And then the last thing I would say is, if they do choose to use a supplement, is it doesn't necessarily work for everyone, but I'm not going to prohibit you from actually trying that to see if that would be something that you would want to utilize in your life. And when we're looking at lifestyle medicine and health, is what are the things that you can implement in your daily life that is going to help you versus some of the things that may not. And I think that that's where you can get the relationship with your patient, is to saying, what would you like to do? Why do you want to do it? And how can I guide you through this journey in order for you to feel better in the end?
Great. Thank you. I think there's a lot of questions. We are officially 4 minutes over. I think we'll take one more and then we'll have to wrap up. But one of the questions is, and I just lost it. This is a great question. Can we always trust the recommended daily dose on labels?
That's a great question. I think the reason why there is data behind supplements and why they come up with the amount of dosage that they have. So yes, they can be trusted as far as recommended daily doses, which is why we have safety and efficacy measures. So that goes back to the question real quick, not to get long-winded, of what is the certification? So although you do have FDA, which is for medications that go by, a very rigorous process, that's why one of the slides was really looking at what is the certification for this product. Did it go through a third-party certification? It doesn't meet a specific standard when you think about safety, quality, and performance. So I think that would come into the thing of, can this be trusted? Is, how are you reading your bottle? What are you choosing to take? And what's the validity behind that actual product that showcases safety?
Right. Thank you.
I would add one more thing to that, is that, often what I go by when helping patients choose supplements is really the data behind efficacy and the amount used in the study. So it's not just the right type of product that you use. You have to use the right amount. 2 milligrams of magnesium is not going to help anybody. However, 400 may, and I often see supplements that list multiple ingredients with no amounts in them. And all those ingredients may sound great. They may be the right, botanicals that are in other studies showing efficacy. But we really need to know, according to what we know and what's been found as far as the amount studied, and that may be actually less or more than the RDA number on that bottle.
Yeah. I mean, I think that at the end of the day, it can be very complicated, and it's really helpful to be working with someone who can kind of help you sort through all of these things. like an integrative medicine physician or someone who's just a provider who's really done a lot of their own homework on this as well.
Yeah, and I think, it's exactly what you said. These are things that we don't traditionally learn in training, going through physician training. So I think that there is a very good amount of physicians who do understand the importance of supplements and are willing to have the discussions that are necessary when people do have questions, and being able to feel like they're not being shamed for taking supplements, and that there really is a good area for everyone's life to find supplements to use. And it doesn't necessarily just have to be for menopause, which is what we're talking about today, but there are other features in life that can really help, whether it's with energy, whether it's with metabolism, so many features. So I think that was a great point that you brought up, Laura. Yeah.